Hello and welcome to the StandPoint. Today we are going to talk about something that most people will run away, would want to shy away from talking about. That is the antenatal and postnatal depression. Children are supposed to be a gift. They're supposed to be beautiful. Society puts so much pressure on women to have kids. When they have the kids and then depression sets in, what will make a woman become depressed after having this reward, this gift that God has given her called a child? My name is Gifty, and welcome to the StandPoint. Let me say thank you to GTP for my clothes, Ophelia Crossland Design Sews for me, makeup products, always by Power Cosmetics and applied by Makeup and More. Thank you to Core Accessories for my earrings today. And I have with me two people who are going to dissect this topic for you and I to understand what it means and how vulnerable we all are as women to getting depressed after having a child. We'll be back. Welcome back to the StandPoint. If you just joined us today, we are talking about antenatal and postnatal depression. Yes, we're going to break it down very soon. But let me say thank you to our sponsors, African Women Development Fund, AWDF, Girl, Yaya Dia, Ahwene Pankasa, Homegrown Oil, Ghana Oil, produced here by Ghanaians. And we know what is good for us. So, Girl, good energy. Wilma Africa, they produce Frital cooking oil and Fortune Rice. Fortune Rice comes in 3 types. And you can identify the types by the packaging, the color of the packaging. The green one is very good for mutu and rice water. The orange packaged one, very good for wache. And then the wine packaged one, very good for jollof rice and fried rice. Well, with me in the studio, I have Dr. Jamila Efriye Khalid, who is a medical officer coming all the way from Takrady to join us today. Thank you so much for coming and welcome to the StandPoint.
Thank you.
Next to her, I have Mr. Seth Mausi Asafo, who is also a clinical psychologist. Welcome to the StandPoint.
Thank you.
Now, let me say that Dr. Jamila is the one who actually brought up this idea that we need to talk about antenatal and postnatal depression. So let me ask you, Dr. Jamila, why did you want us to talk about this?
Well, it's quite common, yet underdiagnosed. And then there's one condition that affects both mother and child. So
both mother and child?
Yes, it does. So
you mean the child gets depressed?
Well, later on in life, the child might also have some other side, which we'll talk about later. Yes.
Okay.
Even in utero, when the child comes, so it affects development of the child as well. Yes, it does.
And when you say it's underdiagnosed, what does it mean?
We don't routinely make such diagnoses, and it's due to a myriad of reasons. First, the women don't report, and that's because people are not even aware that, for instance, if you feel so sad to the extent that you want to take your life, it's abnormal. And it's a clinical condition which needs to be addressed. People are not aware of that fact. And then the other issue is also the health personnel. Yeah, we also don't actively search for women who are going through these things. So they slip through and suffer alone.
Okay.
Yeah.
Okay. Mr. Asafo, what, you don't mind if I call you Seth, right?
Okay.
What is the psychology of a mother? Let's say a woman who's gone through, married, gone through the pregnancy, the whole 9 months, and then will have a child. What is the general psychology of such a woman?
Okay, so usually the psychology, if I understand it, is supposed to be that of a positive emotion.
So, yes.
Usually excessively euphoria, being very happy because you have a child or you're about to have a child.
Yeah.
That's generally what it's supposed to be. But in some cases, that doesn't happen because the whole concept of having to bring somebody into the world is sometimes a very daunting task for most people. And this affects both mother, father, and the family at large.
Right.
Now, In extreme circumstances, when people bank their hopes on, I mean, if people get married just because they want to have kids, it becomes extra for them, or they get overly anxious because they want more, or it's like they went into this marriage just because of a child. And as a result of that, the pressure on them to have a child is higher. And so when they do get pregnant, they wonder a lot, will I have this child or not? Will there be any complications? Will there be? And that in itself causes a number of changes in the body, which can actually lead to a depression in any case, whether it's before the birth or after the birth, so whether it's antenatal or postpartum. Okay. In any case, that can happen.
But Doctor, isn't it normal to worry as a woman? You are pregnant, you know, like it takes a lot, especially if you've wanted the child for a long time, finally it happens, and then all the pains and all that you go through. Is it natural for you to worry whether, you know, things are going to go normally, whether there'll be complications these days that there's so much to read on the internet and all that? Isn't it normal?
It is, but there's a spectrum. You see, when it comes to the world of psychology, it's a spectrum. Yeah, a thin line between normalcy and what would define as abnormal. So with this, it's excessive. With this particular condition, it's excessive to the extent that it affects the woman's ability to function in the home, in the community, at work. You can't. And the other significant symptoms that comes along with it, that makes us know it's actually out of normal, out of the normal range. Yeah.
Yes, but earlier on, Dr. Jamila made a comment that it's being underdiagnosed and that it is a problem. Yeah. Is it really something that psychologists really, you know, and psychiatrists, you know, see such cases often in our environment?
We see it a lot of the time. What happens in the general medical setting is when they notice these signs, they quickly attribute it to hormonal imbalances or the changes associated with being pregnant. So chances are, even if you talk about it, they'll say, oh, normal. You know what I mean?
Yeah.
So they normally won't pay too much attention to it. But when it comes to our field, we pick it up very quickly. Because the concept of normalcy versus being abnormal to us is quite thin. So once we see someone and then they start complaining of, I mean, there are different categories of symptoms. So from the somatic symptoms of I'm not able to sleep well, my appetite and all of that, we are quickly looking at something along the lines of depression for a start. So based on the kind of interviewing that we do, we're able to pick it up and looking at, we know for a fact that there are a lot of hormonal imbalances or chemical imbalances that occur as a result of pregnancy. So it's something we are looking out for. From our line, we're looking out for that. Unlike the general medical practitioner who is looking at other things and not, So we pick it up very quickly. Truth is, it doesn't come to us because of the stigma, which is normally associated with psychiatry and psychology.
Because you can understand why most people would not understand why, for a woman you've given birth, you should be excited, and then suddenly you are always moody. You don't want to go close to the child. Don't want to breastfeed the child. I mean, it's difficult for people to understand, and then if you're not careful, they'll say that there's witchcraft, you know. They will take you to some prayer camp and whip you or something like that. But let's break it down. The antenatal depression, what is it?
So with antenatal depression, it's a clinical depression which occurs during pregnancy, and then it's actually a mood disorder characterized by a feeling of a low mood or feeling very sad, and then it should last for a significant period of time, minimum of 2 weeks, and then it should cause significant...
Like 2 weeks consistently you feel like that?
Yeah, most of the time that's how they feel. That's how come I said it's different from just the normal feeling on getting worried. This one is consistent, it's significant, and it causes distress to the woman. And most importantly, it affects her ability to function. So in the home setting, she won't be able to do the caring for the baby, keeping the home and the other kids. At work, she can't function. And in the society, she can't function as well. So when it hit that point, then we know this is really
and
a
this
problem.
occurs during pregnancy?
Yes, the antenatal is during pregnancy.
Okay, Seth, it looks like you wanted to add something.
Yeah, for, the low mood it's something that we all experience once in a while.
Yeah.
And for pregnant people, yes, they also do experience once in a while. It becomes a problem if only there's an impairment in social functioning. So inability to keep the family, or having problems at work or in church, especially in Ghana. Church is one thing we talk about. The usual point is to say it should last for at least 2 weeks. But that doesn't mean that it's every day for 2 weeks.
Okay.
It's more days than not.
Okay.
So maybe in a week, you experience these extreme moods for about 4 or 5 days in a week, and that should go beyond 2 weeks.
Right.
And this is normally confused with the normal grieving. I mean, it's okay that in the process of being pregnant, if something drastic happens, you might grieve.
Yeah.
But once it exceeds and causes any form of impairment, which is social, occupational, that's when we consider it as a disorder.
Okay.
So the low moods are normal.
Okay.
It occurs to everybody.
Okay.
Yeah. But it's only when it causes an impairment that...
Because I asked because, I mean, there are times that when, with me, the vomiting is excessive, I am tired, I'm so stressed, and, you know, I'm in a hurry to... Let's say, yes, when I go to my second trimester, people are saying, oh, when you get to the second trimester, everything will be wear off. But it wasn't going. Yes. So sometimes I break down and I cry, and I'm talking to God. Why is it, you know, why is this happening? Why is it not stopping? And I'll call my husband and cry, and sometimes be, you know, feel lonely, and then blame everybody around me for abandoning me and kind of thing. But it happens a day or two, and then I'm back, you know, back to normal. So can that also be antenatal depression?
You see, to the extent that you are here and you're functioning. Yes. So, like we said, I mean, routinely, commonly, some women go through some of these ups and downs, anxiety here and there, and all that you are describing. Yeah. But then if it doesn't impair your function, if it's not as frequent as he elaborated, then we wouldn't diagnose you as having antenatal depression. Okay.
Now, Doug, let's move to postnatal.
So postnatal is all about, it's a clinical depression after birth. After birth. Usually after birth. Okay. I wanted to add something to the antenatal
before we
move to. With both antenatal and postnatal depression, there's a thin line between that and postnatal or antenatal anxiety. Okay, so these are comorbid conditions. Now, the anxiety in itself is enough to cause a depression. Depression is enough to cause an anxiety. Right. Now, if you look at the biology of how people get anxious, or the things that happen when you get anxious, you realize that the body in itself, as a result of chemicals, can cause you to constantly be in a low mood. And one most important neurotransmitter that's implicated is what we call serotonin. So low levels of serotonin do cause people to feel depressed. You get it? Now, in the same light, whenever you are anxious, and in most cases, most mothers are, when they're pregnant and then they notice little signs, they start to get worried. Once you start getting worried, the body starts to prepare because it believes that something's going wrong. It's an alarm. So when you start getting worried, I mean, it's normal with everyone. As soon as you start getting worried, that feeling of numbness, loss of appetite, inability to sleep, all these are signs, or they are mechanisms that the body puts in place to fight that alarm or the perceived alarm. You get it? Now, when this is being done, there are a number of processes that take place, and these processes are enough to cause an excess of some neurochemicals, which thereby causes more people to feel even more depressed or even more more anxious. And what's implicated most is our stress hormone, which we call cortisol. I'm sure most people know that. And so the excessive influx of cortisol into the body in itself is enough to trigger the stress response to cause people to feel overly anxious.
Let me take a break. When we come back, we'll continue with this. To be a woman, now, wow, it's not easy, right? Well, let me say thank you to our supporters, Matamis, for giving us the support. Go-Got Yogurt for always supplying us with yogurt. Yogurt is very good for women. I keep saying it. I will never stop saying it. It's very good for women. And thank you to Cake Technique and House of Foods, and of course, Yep Cleaning Services. We'll be back. Welcome back. Thank you to GTP for my Clothophilia Crossline Designs. So for me, Papa Cosmetics always gives us the makeup products and Applied by Makeup and More. My earrings by Kwa Accessories. So Dr. Jamila, what causes postnatal depression?
Okay, so to date, it's not too clear, but then there have been theories to suggest what could cause it. And then key among them is the issue of hormonal changes. During pregnancy, your progesterones and estrogens, which are your pregnancy hormones, they surge. And then after delivery, when the baby and the placenta comes out, it falls. And that rise down, fall down thing sort of could precipitate the postnatal depression. And then the issue of genetics, because it's been realized that women, non-pregnant women, their risk of getting depression is higher than their male counterparts. So some way, somehow, it's believed something in our genes makes them more at risk of getting depression. And then the issue of sleep deprivation, which, pregnant women or after delivery, you can't run away from, but it does have a toll on your mental health. And then another hormone that has been mentioned is the thyroid hormone.
Okay.
Yes, when that one too drops significantly, it could also predispose you to depression.
Okay. Okay. So Seth, it's not necessarily something that the woman does that leads to postnatal depression.
So what she's talked about is the biological aspect. We have the more behavioral aspect, which has to do with like situational variables or things that change. Now, for starters, having a child is a significant change in any woman's life. Not just the woman, the men as well. Let me talk for them.
Okay.
So that change in itself becomes sometimes problematic for most people who are not expecting it. Now, you've noticed that people who didn't plan the pregnancy, for starters, have a higher rate of developing a postnatal depression.
Okay.
People who have significant financial problems have also a higher rate. People who are in difficult relationships, or maybe a husband is overly aggressive. There was a study where
abusive
there was a study that showed that for women who had husbands who they feared, their levels of cortisol rose significantly during pregnancy, and because they were afraid they might probably be harmed by these men and they could lose the pregnancy.
Definitely.
So that sort of follows through the process until they give birth, and the fear is still there. And so that causes that lingering effect. Then also there's the issue of it's my fault. That's how I call it.
Okay.
So most women do not realize. So in that phase, they kind of expect that everything should be done their way. And they will not listen, or they don't see the point of anybody else. And so people start to shun them. And that in itself makes them start to feel worthless or lonely. And that could be another trigger into the depression. And then the loss or significant loss of something. Maybe somebody, they lose a family member, just like in general depression. But the tendency for it to get excessive becomes high because they have had a child. So these are the social aspects of why people may develop a depression.
Just to add to it, if for instance you lose your child, that is also a high risk. And I quite remember we had a patient, 38-year woman, who had been managed for subfertility or infertility for well over 6 years, and had surgeries. Finally, she gets pregnant, and unfortunately, it gets complicated. She ends up on the theater table. The baby comes out and it's dead. And what is more, she loses her uterus, her womb, because there was a very bad tear which we couldn't repair, so we had to take that out. So for a woman like that, in fact, she broke down in tears when we told her, and we had to follow her up because she was a high-risk patient who could suffer because she had lost the baby. Yes, and also in our setting, women who give birth to children with birth defects also are at high risk of developing depression. When I see the women who come with babies with cerebral palsy, you can tell it on their face. They are so sad, and it's not easy. And sometimes conditions the women might experience after delivery. In the northern parts of the country, fistula, it's quite common. And that is one condition a woman that could dip a woman into depression. So bits and pieces here and there. And then personally, I mean, depending on your childhood as well. Yes, the psychologists will tell you everything that happens during the childhood has a telling effect on your adulthood. So if you suffered sexual abuse or violence, emotional abuse, emotional neglect, or you were in a dysfunctional family, so say divorced parents or domestic violence, it could also further increase your risk.
So basically because your hormones are kind of, battling each other, or they rise so high, the things that you've kept inside and harbored inside can really can be triggered, and then it leads to something else. Is that what you're saying in terms of the childhood abuses?
So what we are saying is that when it comes to postnatal depression or antenatal depression, it's a myriad of reasons. And it has what he said, the psychological bit, the biological bit, and it all comes to play to give you that diagnosis, I mean, to give you that presentation. So it's not like one triggers the other per se, but it works in unison to give you that,
Said, how can you detect?
So
for the ordinary person, not you, the professionals.
Okay, to the ordinary person, as a woman, when you have a baby, and after about 2 weeks, so right after birth, most women experience what we call baby blues, which is also just like depression, but it passes on very quickly. So that low mood, not wanting to get close to their child, a certain fear of something that has not been accomplished, that one is there, but it passes very quickly. But if it extends beyond 2 weeks, you realize you have a decreased need to be close to your child. You're constantly aggressive towards your partner, which is the most common one. And in many cases, your in-laws, your friends, you feel like you want to be distant from them. You're not able to enjoy the activities that you used to enjoy. You're not able to sleep as you usually would. And if you're getting sick quite easily, common colds or things are not repairing as quickly as they should, these are all signs that you may have a postnatal depression. But the caveat is it should have been after birth.
It should be after birth.
Yes.
Okay. What about when you are overly possessive and protective of the child after birth? Like you don't want anybody to get close to your child.
Well, that's not the norm. And that's also overboard. Because you are being overly protective. And like I said, it's not the normal thing to do. And if it's to the extent that you end up harming the baby, that's also not the best. And it could also be a sign or a symptom of some psychological issues.
What's the worst form of postnatal depression?
Well, they could actually harm themselves or take their lives or harm the baby. Or they now get psychotic. In severe depression, now they get what we normally would call the person, say the person is mad. They get aggressive, they see things no one is seeing, they hear things no one is hearing. And when they hit that, they've hit the roof.
You want to add
No, that's exactly what she said. So it's what we call a depression with psychosis or psychotic features. And essentially a psychosis is hearing voices, which is hallucinations, believing things that aren't really there. And that one of them is paranoia. The belief that maybe someone is trying to harm you or the whole world is against you. So that is the psychotic aspect, which is out of coverage area.
Out of coverage. But most of the time after delivery, everybody's focus is on the baby, not really on the mother. So how can we pick up?
The thing is, the focus is supposed to be on the baby anyway. And the mother is also excited about the baby. So it's not supposed to show, or there's not supposed to be a sign like you've been neglected per se, But the other things that happen around it, where the mother is detached from the child. I mean, if your child is getting that attention, you're excited because in extension, you also get the same thing. But if you're detached from the child and you don't want to get close to the child, then people will start saying, but you why? But you why? And that in itself becomes a bother, which you're constantly ruminating over. And then that leads to the whole worry cycle. And before long, you're hitting the moderate or mild to moderate kind of depression. And if that goes unchecked, then you go into severe depression.
Depression, yeah. Is it possible for you, the woman, to yourself to notice that I'm getting depressed?
Oh, yes, it is. But not too often. It is. Because with depression, it's not like psychosis that they lose touch with reality. With psychosis, that one, they are ill, but they don't have insight into their condition. But depression, they know that's how they feel. But the issue is whether they are willing to share it with someone. But more often than not, when they raise it up, it will probably, in our setting, they'll brush it aside. They'll trivialize it. They'll make fun of it. And then it also comes along with some form of guilt. I mean, you have a new baby, you're expected to be happy. And here you are wallowing in self-pity. And so, I mean, they don't even feel like talking about it at all. Yeah.
Let me take another break. Well, the Standpoint is sponsored by Wilma Africa. They produce Phyto cooking oil and Fortune Right. Fortune Right comes in 3 types. That's the in types of, you identify the types by packaging. So the green package one is very good for the soft dishes, omutuo and rice water. The orange one, very good for wache. And then the wine package one, very good for jollof rice and fried rice. And also thank you to the African Women's Development Fund. Remember, this program is aired on ABN TV, on Sky Channel 235, which is across Western Europe, parts of Canada and Asia. And we are also proudly sponsored by Ghana Oil Company Limited. Goil Good Energy, Goil and Winepankasa, Goil, dia, homegrown, and we know what is good for Ghanaians. We'll be back. Welcome back to the Standpoint. Again, I say thank you to Matames, to Yep Cleaning Services, House of Foods, and Cake Technique, and of course, Gogot Yogurt for supporting us. Now, Dr. Jamila, you talked about child depression as well, that all these things can also affect the child?
Yes, that's what I said. And so in the womb, it could affect the development. And so you might end up having a baby earlier, that's preterm. And when it comes, it might have a low birth weight, so small weight. And then as it grows, its cognitive skills could be impaired, so intellectual skills. And then also another thing we've noticed is that babies or children of depressed women might get malnourished. Yes. And then that in itself is not also a good thing. Or they tend to get diarrheal illnesses as well. Now, later on in life, they might also experience certain psychological problems, ranging from low self-esteem to not being able to fit in so well with peers. Some get so aggressive. And then also, some would also have a tendency to develop psychiatric illnesses later on in life. And then others too might fall on drugs, so drug abuse and things like that. So, and sometimes to the language development is also affected.
Wow.
So all these can affect the child of a woman with depression.
So that's good. Is it because of maybe the neglect that
Yes.
he or he suffers?
In that case, perfectly. But it's not as if the depression in itself has some form of power to cause structural changes in the brain per se, no. But it's the feeling of, I can't seem to get going, I can't seem to want to do anything. So I will not even take care of myself. I'll not take my pills. I won't go and see the doctor. If there's a complication, I'll just sit at home. It's those things that cause these complications that can later on affect
the baby.
Yeah. So in most cases, when a child is born to a mother and it's recognized quite early, well, the child will have a very normal development. But if it persists and it goes undiagnosed, then it means that the child is going to lack or will be neglected in that regard. And for children, majority of their psychological development is in the few months after birth. I mean, in the latter months of pregnancy and a few months after birth, where they form the bonds, and then they believe that the world is trusting. Because if the child cries, and then daddy is there, mommy is there, they form a sense of bond or a sense of trust for the world. Unfortunately, for a depressed mother, She won't do that. I mean, you can cry all she cares. And so then they start to have all these other deficits in development with regards to embracing the world. And that's what may go on to cause these psychological distress. But the depression in itself will not cause it. Exactly. It's an indirect connection.
But no, okay. So how can it be prevented? I'm not talking about treatment. Okay. Prevented.
Well, prevention per se, that's very difficult to say. But generally, exercise is good because once you exercise, it activates what we call the happy hormones. So once you have enough of these happy hormones, it should be able to restrict its severity to some extent. Then again, the issue of social support, which we get a lot of in our part of the world. I mean, we are more towards the external family system. So when you're pregnant, you have a lot of intrusion. Now, the problem is sometimes it gets overboard, and that is enough to get
too much intrusion.
You know, too much intrusion. But the most important point for me is go for regular antenatal checkups, because then it can be picked much quicker. And if it's to put you on medication, it'll put you on medication. If it's psychotherapy, you'll be put on psychotherapy in that regard. So for me, the prevention points are exercise, getting to your, going for your checkups as usual.
What about treatment?
Well, treatment, it ranges from psychotherapy, what we call the talk therapy, to medicines, to what we call electroconvulsive therapy, and then a bit of self-help tips, which she's mentioned some, like the exercise, eating well, sleep. You remember I mentioned sleep deprivation as a causative, or as being part of the causative, as being part of the causes. It's difficult to have enough sleep when you have a baby. But then with good support system, you could have enough sleep. And so I think you touch more on the psychotherapy. So I'll leave that.
Okay.
So the kind of treatment that we employ depends on the degree of severity of the depression, as it were. So for mild to moderate level depression, we normally do what we call psychotherapy or cognitive behavior therapy, where you help people to identify negative patterns of thinking, identify significant stresses in their life, be it their husbands or their family members or work or whatsoever, and then find ways around it. Now, in cases of severe depression, we don't have a choice, but you have to take medication. And research on whether medication affects the fetus is inconclusive as we speak. But normally you have to weigh the net good over bad. I mean, even water has side effects. You know, so that's what we do. But ECT, like you mentioned, electroconvulsive therapy, is usually preferred because it is short. The therapy in itself is short and can last for a longer period of time than when you're put on medication. And even for medication, they ask you to give you take the medication after breastfeeding or maybe late into the night, so that the child doesn't directly have to get the effects of that. Now, some people have argued that children may become dependent on such medication. It's not in all cases. There have been rare incidences of that, but like I'm still saying, it's about the net good over bad. And in most cases, it is better to intoxicate small than to,
to go overboard. Okay.
And so for the psychological aspect, in essence, we psychologists believe that majority of disorders are a learned behavior. So it's something that you've learned over a period of time. And in order to get over it, you have to unlearn it. You know, there's a theory that says that if you wear a smile, you get happy. You know? So it's more like saying that the brain is able to read cues that we give it. So if I'm in all those down moods and I feel like I don't want to do anything, it's the job of your psychologist to point out to you that because you're not trying, you won't even see it, which what happens normally in depression. They won't even start because they say, I want to enjoy it. But you have to let them start and see that, oh, there's some level of enjoyment. And so learning has taken place. So that way you're able to challenge their negative thinking patterns, which is maintaining the depression. In the same light, when you think in such ways, it has an effect on the neurochemical components of the brain. So you have an excess of what makes you sad.
Okay.
And you maintain or keep you in that. So our job is to help you think in more positive ways to undo that effect essentially.
Okay. So it's important to be in a happy environment.
It's very important.
All right. Dr. Debla, in conclusion.
Well, so in conclusion, to my health colleagues, what I would have to say is that we should be on the lookout for these things. They are subtle. The women won't come out saying, I'm depressed. But they'll come in all sort of ways. My here, I feel pains here. They keep on coming. Their countenance alone sometimes gives them out. So we should be on high alert to pick up some of these cases. And when we do, we refer them to the appropriate courses. And for the women, if you begin to feel some of the things we've mentioned about, don't shy away from it. When you attend postnatal clinic, mention it to your doctor. Mention it to your midwife. When you come to the pediatric unit, mention it to your doctor as well. And we would always be happy to help.
Okay. Said.
My conclusion is that a depression does not make you... my colleagues won't allow me to use the word mad. You say mentally challenged, okay? Right. It's nothing like that. And for most people, they believe that if you go to a psychiatric hospital, you are out of your mind. It's very inaccurate. You can attribute these illnesses to a diabetes or whatsoever. Also, in many cases, you realize that people may be suffering a depression, but the clinical presentations are more physical, like a headache or excessive gas and all of those things. It is because of the theme of worry that underlies that change, the drastic change. So in as much as it may show in physical or medical symptoms, it's worth investigating to be sure if there's a psychological component. And please, we are there for you. Don't shy away. You come. Okay, thank you. That's all.
The clinical psychologists too, they have to be friendly.
Hey, we are too friendly. We are too friendly.
You don't have to ask too many questions when we come.
The questions are important. Ask for the question we'll ask.
Well, thank you very much for this education, and I'm sure we'll have to do this very soon. You know, we'll have to do this again very soon because it's been very, very educative. Thank you, Dr. Jamila and Seth Asafo. Well, we take a break. When we come back, I'll give you a bit of me. Listen, I keep saying this, women. We are not super women. We are not superhuman beings. We are vulnerable like any other human being. We have our ups and downs. We need to speak up. We need to talk about it. We need to take our destiny into our own hands. And talking about our destiny, our health, our finances, our relationship, our children, everything that will make us function as normal human beings, we need to work at it. Woman, having a child is beautiful. It's a blessing. Society heals it. But we need to prepare. Mentally, psychologically, emotionally, financially, physically, we need to prepare for it. Look forward to it. Understand that it's going to be difficult. But when they come, know that there's help. There's help out there. Go and seek help. You can't give what you don't have. You cannot give what you don't have. Enough of the pretense. We've been pretending for too long. Pretending everything is okay. Pretending we are happy. Pretending we are financially okay. Pretending we are mentally okay. We've been pretending for too long. And it's time to let go and be ourselves. There's help out there. If you're a religious person, yes. The church is there, the mosque is there, the religious leaders, whatever, they are there. But there are the professionals as well. The psychologists, the psychiatrists, the medical doctor, the gynecologists, the pediatricians, they are all there. And finally, no one can make you happy if you don't want to be happy. It's a decision you have to make. Well, my name is Gifty, and as always, I have super crazy faith in God that no matter what, He's got me covered. And I'll go through it. There'll be downs, there'll be ups, but in the end, grace will find me. I'm here talking plenty, not because I know it all, not because I've been through it, but I've learned. And I've understood that we can do it if we set our mind to it. Depression is not a disgrace. Depression is not a stigma. Please seek help. Thanks for watching. See you same time next week. Bye for now.